My name is Lasith Ranasinghe. I'm one of the authors of RevMED, and I'm also an academic foundation doctor in the Northwest London Deanery. So I'm just going to talk briefly about how we actually went about writing the first book, and then Ollie will introduce himself and talk about our more recent one. So essentially, some of you may have experienced this feeling already, and some of you may be soon to experience this. But essentially, we found that when we transitioned from preclinical years to the clinical years, we felt a little bit lost almost, because preclinical years, as difficult as they may be, the boundaries or the limits of your knowledge are fairly clearly defined, because you have a certain number of lectures that you need to learn. Whereas in the clinical years, it becomes a lot more confusing, and it becomes somewhat of a guessing game where over time you develop a better gauge of what you need to know and what you don't need to know. And one resource which we found very, very useful throughout our clinical years were SBAs. And we'll go on to why that is in the next few slides. But in terms of why we went about writing the SBA book, it was mainly because we found that the SBA books that we used, as useful as they were, some of them were perhaps a little bit outdated, but more importantly, they were all more or less written by quite senior doctors, meaning that a lot of the time the explanations may have been pitched a little bit higher than what we were anticipating. So essentially, we wanted to try and set ourselves a task of trying to make a resource which would basically deliver as much content as comprehensively and nicely as possible, but with a student-friendly touch, which made it easy for students to actually digest the information that we presented. So we'll talk a little bit more about SBAs a bit later. I'll pass it on to Ollie to introduce himself.
Hi everyone, my name's Ollie. So thank you all for being present for our talk. I hope you find it useful. So like Laz, I'm an Imperial graduate, and I'm due to start my foundation post at the Royal Sussex Hospital in Brighton. So I just wanted to introduce our second book. So it's the one on the right, the one in red. So this was released in March this year, and it's a 300 SBA book in the clinical specialties. So that covers psychiatry, pediatrics, and obstetrics and gynecology. So we thought this is an important addition to the first book because the specialties have a reputation for being quite complicated. They have extensive diagnosis and management guidelines. And the questions in specialties also rely on less passive recognition and less buzzword recognition, but more so on clinical judgment and a comprehensive understanding of these up-to-date guidelines. So what we've done is we've created these kind of comprehensive clinical vignettes, so that when you look at the questions, you need to take into account the entire story rather than just relying on this kind of buzzword pattern recognition thing. And more importantly, we've broken these lengthy guidelines created by NICE and other kind of bodies into simple and easy to follow explanations and rev charts. So hopefully our book can be used not only to kind of quiz you as exams approach, but also to learn like you would a textbook. And for people who aren't familiar with what SBAs are, we're going to show you a few a bit later. So pass you back to Laz.
Okay, so just moving on. So Ollie and I have both been to quite a lot of these types of talks over the years whilst we were at med school. And one thing that we found was a lot of them may have had the odd kind of useful tip in them, but they tended to be quite vague, and that can be a bit annoying because you want to walk away with some fairly sort of practical measures that you can take to improve your chances of doing well in your exams. And with this talk, we've tried to make it as sort of pragmatic and practical as possible. But to begin with, we're going to talk a little bit in a sort of like a waffly way about the challenges of medical school, just to make sure we know exactly what we're dealing with. And most of you will be able to empathize with this, but realistically, the challenges of medical school in terms of exams can probably be divided into three main domains. So first of all, there is a huge amount of stuff you need to learn. So you might have 300 lectures in second year, you might have 300 diseases in third year. There's basically a huge volume of stuff that you need to learn, and that can in itself be quite daunting when you set about revising. On that note as well, you have a huge amount of variety as well, even within medicine. Like, we know it's a science topic, but for example, there's a huge difference between revising renal physiology on one day and then revising neck or femur fractures the next day. So essentially, medicine will require you to apply various different types of sort of thinking and applying concepts within medicine itself. And finally, something that affects all of us, we'll all have our social lives, and family lives, etc. So time constraints are quite a big issue. So that means that when you're preparing for exams, you want it to be as efficient as possible. So before I move on to the next slide, let me just see if I can turn off these. Play sound when someone joins and leaves. Okay, those annoying TikTok sounds probably should have gone by now. Okay, so on that note, there's a bunch of different resources that are available to you when you're trying to prepare for exams. And I think the wealth of resources in itself can be a little bit, I don't know, a little bit daunting, because sometimes people will have all these things in front of them and they won't know how to actually go about preparing. So I think you can probably break down resources in medicine into 4 main domains. So textbooks, Google, lectures, and practice questions. And all of these have their merits, and they can be used very effectively. And I think as a whole, a lot of medical students are quite accustomed to using lectures, textbooks, and Google. And what we're going to focus on today is practice questions, mainly because it is our area of expertise, and also because we feel that it's something that isn't quite used to its maximum potential. And we'll talk through some fairly specific ways how practice questions can be useful. So with regards to that whole initial approach to revision, I've seen so many students worry for ages and ages about how they should actually go about revising. They worry about which resources they should use, whether they should make notes, whether they should use someone else's notes. And that tends to take up quite a lot of time. And in a way that does eat into the time you have to actually learn these subjects. So I think when someone asks me that question, you should always boil it down to what type of knowledge do you actually need as a doctor. So this is more applicable to the clinical years. But I'd say knowledge as a whole can be divided into either discrete knowledge or pattern recognition. And I've used a kind of cheesy example to highlight which of these 2 types of knowledge are more important as a doctor. So imagine you're an F1 or Reg or something at 3 a.m. on a Sunday morning. A nurse is unlikely to come up to you and say, doctor, can you list 7 clinical signs of pulmonary embolism? So that's pretty much not going to happen unless you have quite a strange nurse. Whereas a nurse might come up to you and say, doctor, one of our post-op patients is unwell. He has an oxygen saturation of 84% and a heart rate of 140. So just from this quite crude example, you can see that medicine in practice is all about pattern recognition. And that's why we think SBAs are quite useful to learn pattern recognition. Textbooks and Google are amazing for backing up your discrete knowledge, and that is still very useful and it is tested in exams. But from a pattern recognition point of view, doing SBAs is sort of like the gold standard. So I'll hand it over to Ollie to go through an example of this.
So we're just going to show you what a couple of SBAs look like, and also why they're actually effective ways of testing your knowledge and learning from. So as Lasith was saying, this is a Google extract of Conn syndrome, so an important condition that you'll study in endocrinology. And we just want to show you that whilst Google is obviously brilliant for studying, it can be difficult for medicine because often the information isn't isn't digestible or engaging, and it might not actually be medical student friendly because most websites are often aimed at patients or actually clinicians. So it can be a bit too far below you or a bit too far above you, above the level that you need to know. And there are also tons of resources and websites out there. So it can actually be hard to filter through that information and find the information you're going to be tested on. So if you just move on. Okay, so this is where we think SBAs come in. So this is an example of one of our SBAs. And what you have to do is you have to read through it and you have to work out the most likely diagnosis and associated ECG pathology, given this patient's history and examination findings. So I'll give everyone a second to read and you're welcome to have a go. So there are 5 possible answers and they may look similar. And in some SBAs, the answers may actually all be partially correct. And that's what makes SBAs challenging, because you actually have to choose the one that's most correct. If we go on to the explanation. Okay, and this is the answer and explanation of the SBA. So as you can see, the explanation is quite concise, and it also contains all the main points about Conn syndrome that are relevant for medical students' exams. And as Laz mentioned previously, one of the main difficulties of medical school is the sheer volume of knowledge that you have to acquire. And this is why we like SBA so much, and this is why we've produced the 2 books, because they present SBAs, the explanations present information in these short, digestible chunks, and it means you don't have to filter through boring blocks of text on Google. You've got it right in front of you. And I also find them effective because whilst they go through the right answer, they also go through the wrong answers and explain why they're incorrect. So for instance, in our question here, you can see the second paragraph is actually going through the other ECG findings that were mentioned as possible answers and their associated pathologies. So this means you're not only learning about Con syndrome, but you're also learning about other important conditions that are likely to come up in exams. And just overall, I've always found SBAs to be a much more interesting and engaging way to learn, as you have to really think about the question and consider each possible answer. I'll pass you back over to Laz.
Okay, so we're just going to go through one more example, and then we'll actually give you sort of like almost like a study plan to explain how you can basically harness all this to maximize your efficiency. So this is a textbook extract of ectopic pregnancy, which is a very, very important topic in gynecology. And I really like textbooks, and I like referring to textbooks because within a good quality textbook, you can be pretty sure that all the information you need is somewhere there. The only issue is that it can be a little bit difficult to actually process it. So you can see that this double page spread has a lot of information on it, but it's all written in prose. It's a bit difficult to really engage with. So that's one thing that we found, that with textbooks, it does take quite a lot of time to actually get the information out of it. Similarly, with fifth year in particular, which is when we do the specialties at Imperial, a lot of it's very guidelines heavy, and guidelines are a pain to learn, not necessarily because the guidelines themselves are that complicated, but extracting the information is an absolute nightmare. So the NICE guidelines is obviously the go-to place for guidelines in the UK, and it's a bit of a cumbersome website to navigate through, because you'll find a page like this, and then within that page you need to trawl through loads of different chapters before you actually find the bit that you're looking for. And an idea I want to introduce right now is a bit of a paradigm shift. So I'd say the majority of students will only really do SBAs right at the end of their revisions. So they'll make amazing notes, they'll go through all of them, and it's only after they feel somewhat confident in their knowledge that they'll actually transition into doing SBAs, and often that's quite close to exams. So one thing we'd like to encourage is for people to start doing SBAs a little bit earlier, because you can learn a huge amount just from doing the SBAs. So rather than using the SBAs to test yourself, they should be something that you use to complement textbooks and notes, etc., to actually learn some of the content itself. So I'm just going to give you this example on the same topic of ectopic pregnancy. So even if you knew absolutely nothing about ectopic pregnancy, just by reading this 4 to 5 line vignette, you will already have learned how it presents and which investigations are usually requested for ectopic pregnancy. And you'll also have a look at some of the management options. So even if the core part of the question is something that's completely alien to you, just reading this vignette and having that case in your mind and just processing it will mean that you have some awareness of what an ectopic pregnancy looks like in terms of its clinical presentation, and which investigations you should request when you suspect ectopic pregnancy. So even if the actual explanation is focused on one part of the question, in this case management, the fact that you've read through that case and engaged with that case means that you've actually gained a huge amount just from doing that SBA. So we're just going to move on to give you some very specific tips in terms of how to harness or get the most out of SBAs.
Okay, so just to reiterate what Laz just said, so some people are often quite hesitant and fearful about starting SBAs because they think they might not know enough. But one of our main takeaway messages is that SBAs don't have to be kept at the end of the year as you're kind of approaching exams. There's no harm in doing them earlier in the year and getting them wrong. And that's because, as Laz said, you can actually use them to learn from and update your notes and using the explanations. So for my 5th year, I started doing SBAs about 4 to 5 months before the exam date. And before that, I was doing other things such as writing notes and going over lecture slides and things like that. And then I'd use the SBAs to actually update and expand my notes and just become more confident with approaching questions. However, in my third year, I actually spent the majority of the year writing notes, and I left SBAs basically till the last minute. I left about 3 or 4 weeks to do them. And I just found that I didn't finish what I wanted. I wasn't able to go through the explanations thoroughly. And I actually did significantly better in my fifth and final year when I started SBAs early. So that's one of our takeaway messages. You can never really start SBAs too early. And the other thing is just do lots and lots of SBAs. There are tons of different resources. There's a Get Ahead, Pass Med, Pass Test. There's obviously RevMED as well. And by the time the exams roll around, you'll be so confident when approaching SBAs. And I think what makes the clinical years quite daunting is that it can actually be, it can be difficult to know actually what you need to know. I think it's quite common for people to worry that they aren't learning enough, or they aren't learning the right things, or they're diving into something a bit too much. And SBAs can actually be a very good indication of the level of knowledge that you're required to have for your exams, and also what conditions and what tests and management plans actually are examined a lot. So therefore, what you should focus your revision on. I'll pass you back to Laz.
Okay, so the next point is one which is perhaps a little bit contentious, and some people will completely flat out disagree with me. But I'd always recommend revising topics. So in terms of just going through notes and also going through SBAs in a varied fashion. So a lot of people like to compartmentalize medicine very rigidly. So they might do cardio on Monday, rest on Tuesday, and so on. But I'd perhaps recommend doing perhaps about 3 topics per day. That's in terms of notes. And in terms of SBAs, I'd recommend going for resources where you can basically have a mix of SBAs. So you don't know which topic is going to be put in front of you next. The reason I say that is because hypothetically, let's say you've revised cardio and you want to do some cardio SBAs. So some books are laid out in terms of specialty. The issue is that when you read through a set of cardio SBAs, which you know are cardio SBAs, it already gives you a bit of tunnel vision. So if you have got a question about chest pain, for example, you are more likely to choose the cardiac cause of chest pain as opposed to the respiratory or musculoskeletal cause. So essentially, it sort of primes you for the SBA and gives you a bit of an advantage that you wouldn't have in your exams, and I suppose you wouldn't have in real life, because when you're the on-call F1 or registrar, you're going to have loads of different patients put in front of you, and you need to learn how to evaluate clinical situations with a clean slate without thinking that, oh, this is cardio, this is derm, etc. So I would definitely recommend trying to keep topics varied. I know that can be a little bit disorientating, but I think in the long run, it does sort of improve the accessibility of information, and it improves your pattern recognition capabilities. And finally, the last point, if you take nothing else away from today's talk, I think this is perhaps the most powerful revision technique that I discovered, mainly over the second half of my time in med school. But basically, there's a lot of these online flashcard type tools, which some of you may already use. Brainscape and Anki are 2 of the big ones. And essentially, they are amazingly powerful for patching up gaps in your knowledge. So one thing that I would get in the habit of doing is I'd go through a bunch of SBAs. So let's say I did 30 SBAs. And by doing those 30 SBAs, I find that there's 10 facts or 10 points which I never knew or I didn't know so well. I'd turn each of those 10 points into a question, and I'd put those questions onto an online flashcard like Brainscape. So essentially what happens is over time, so let's say over a week, I'll end up with this online Brainscape deck, which is essentially a set of questions of just my weak points in my knowledge. And then the beauty of the sort of Brainscape Anki algorithm kicks in, because you look at the card, the question on the front, you think about the answer in your head, and then you look at the correct answer on the back, and then you rate that card in terms of its difficulty. And it's quite a simple algorithm. Anything you rate quite high in terms of difficulty will come up in the deck more frequently. So essentially, it's a systematic way of plugging the gaps in your knowledge. And that's something that I found unbelievably powerful in terms of developing my knowledge base in the build up to exams. And on that basis, I just want to introduce this idea of staggered revision, which is something that I found worked amazingly. So I know I just said do like 3 topics per day, but for the sake of simplicity, I laid it out like this. So imagine there's a fictitious medical student who does cardio Mondays, rest on Tuesdays, Wednesdays gastro, etc. The issue with this technique, even though at the end of Monday, they may feel like a cardiologist by the end of it. The issue is that over the course of the week, you will slowly lose that knowledge you gained on Monday. So when you get to revising cardio the following Monday, you actually aren't much further ahead than you were the week before. So this is why I recommend this whole staggered revision approach. So this is how I would do it, and it worked very well for me. I'd recommend you at least give it a go. But I'd basically use that Brainscape deck and do the cards for whatever topic, let's say cardio, about 2 or 3 days after I studied the topic through notes or SBAs. So essentially, it means that I refresh my knowledge and revisit that topic at least twice a week, because the beauty of it is that Brainscape and Anki, the decks of cards are so quick to go through. It doesn't take more than half an hour, maybe 45 minutes per day to just go through all those weak points and refresh your knowledge. So it's incredibly useful to have a separate bank where you can easily access your weak points and reinforce them on a more regular basis than your standard revision. And that's something that I would recommend to everyone. I personally don't really do timetables just because it's not something I've ever got used to doing. But just having that principle of refreshing your memory by doing some Brainscape cards 2 or 3 days after you've covered a topic is amazingly powerful. And moving on, we've got a few top tips.
Okay, so this may seem very obvious, but I found that some people don't really do it. But it is a brilliant idea to actually maintain a list as you study. So this could be kind of a list of the specialties that you are being assessed on, and then within each of those, a sub list of the conditions that you need to know for your exam. And as you study throughout the year, this could be updated, and certain things could be ticked off or highlighted when you're actually comfortable with them. And this is good because as in the weeks leading up to your exam, you know exactly what to target your revision on. You'll know your weak areas and you'll know what you're not very comfortable with just by referring to your list. And also just, it can seem like a huge volume that you have to learn. And I think a list just makes it a bit easier to visualize and just makes things seem a little bit more manageable and less stressful. Next slide. And this I think is a really important point. This is something that I only really maybe realized in the second half of medical school. So medicine is obviously gigantic. There are tons and tons and tons of complications, drugs, and eponymous syndromes. And it literally is just impossible to learn absolutely everything. Obviously learn as much as you possibly can for your exam, but common stuff is common, and it's common in your exams, and it is common in real practice as well. So really you should be prioritizing the most important conditions. And then if there's time and if you're comfortable with the main things, you can then begin to branch out into other areas and things that you find kind of more interesting. In my third year, I had a tendency to get a bit carried away with the eponymous syndromes. I'd learn loads about, Fitzhugh-Curtis syndrome and forget the difference between type 1 and type 2 diabetes, which is obviously much more important and very likely to be in the exams. And again, this is where SBAs are useful because they're a bit of a reality check of what's actually going to come up in your exam. But you will also pick up these niche kind of eponymous syndromes by doing SBAs. So overall, just try not to get hung up on the little things. And chances are, if you are stressing about not knowing these tiny details, you probably know more than enough to succeed in your exam. I'll pass back to Laz.
Okay, so this next slide, some of you may think this is quite obvious, and for others, it may sort of ring a bell with you actually. But essentially, it's this concept of know what you know. So I find that a lot of people I've met throughout medical school, when they revise, they'll go through it in a very sort of systematic, metronomic A to Z way. So let's say you're revising pediatrics, they'll go through all the subspecialties within pediatrics, and they'll go through it again and again and again, which is how revision works. But they'll go through it again and again in the same way. So what I mean by that is, let's say hypothetically, you revise pediatrics, you find that pediatric respiratory medicine is something that like clicks with you. You know it inside out, you're very comfortable answering questions on it. But let's say pediatric gastroenterology is something that you haven't quite got to grips with, and it's somewhat of a weak point, you don't do so well in SBAs, and it's something that you would perhaps struggle with if it came up in the exam. So that would be in the red bubble, and the pediatric respiratory would be in the green bubble. Essentially, I'd say the vast majority of people who do this do this A to Z revision thing, essentially revise everything, whether they know it or not, in the exact same way and at the exact same tempo. What I'd recommend as an alternative is to honestly evaluate what you feel like you know well and what you don't know well. So this can be difficult for some people. I mean, everyone has that friend who claims they're going to fail the exam and then ends up like top of the year. But for the vast majority of you, you have some sort of intrinsic understanding of what you are confident on and what you're not so confident on. And it's important to make sure you sort of target your revision, especially the more times you go over a subject, to make sure that you do strengthen your weak points, because the things that you're strong on, you don't have to worry so much about. And this can actually be complemented really well with things like Brainscape and Anki and online flashcards, because again, that's also another way of targeting your weaknesses. So essentially both of these techniques together can be very, very good in developing a very strong foundation in terms of your knowledge.
So this is something I used to do quite a lot, especially living with Laz. And in hindsight, it was never helpful and often just added to my stress. It can be easy to panic when somebody knows something that you're not very comfortable with or you don't know. And it can be easy to forget how much you actually know. But you often know far more than you think you do. And you're likely to know things that that person actually doesn't. Medical school can be very competitive, and medicine is obviously a very competitive career path. But I think it's just important to run your own race and try not to get bogged down by what other people are doing. Everyone learns in slightly different ways, whether that's using Brainscape for flashcards or writing notes, going over lecture slides, SBAs, post-it notes, whatever. But I just think it's a good idea to find a way that suits you best early into your training. And just don't stress if your colleagues are doing different things to you, because they probably will be doing different things to you. But just find a way that works for you and try and stick with it. And try not to worry if people know different things than you do. Much about the last.
So the final thing we're going to go through is about extracurricular academics, and it's something that both myself and Ollie have got loads and loads of questions about, just because it is a fairly stressful concept, because you see all these people around you who are doing projects and whatnot, and it can be difficult to actually wrap your head around it. It's also difficult to give any sort of blanket advice about how to go about planning extracurricular academics, but I've tried to break it down in as logical a way as possible. So whenever you think about embarking on some sort of extracurricular academic venture, you do need to be honest with yourself about what's the actual reason you're doing it. And I'd say the reason can be split into three different groups. So first of all, there's points. So that's essentially points for specialty applications or FPAS points or anything like that, which is a completely legitimate reason for doing it. There's no shame in it. I think most doctors will have done that at some point. And it's perhaps the most common reason for people doing extracurricular academics. And there's also personal interest, which means that if you're particularly interested in some sort of specialty, you may want to explore it a little bit more. And to be honest, when I was a first year, I remember being quite intimidated by the fact that there were all these other 18-year-olds who wanted to be oncologists or pediatric surgeons, and I still have no clue what I want to do. And then finally, personal venture. And what I mean by personal venture is something that's a little bit slightly sort of off the norm, so a little bit unorthodox. So included in that would be things like developing apps or websites or books. So something that isn't stereotypically done as an extracurricular thing. So first step is basically being honest with yourself. Which of these is my prime motivation? So if it's points, I'd say the most important thing to think about is efficiency. So I've seen loads of people just doing these random projects without actually knowing how it would materialize in terms of their future gain. They have this vague idea of, I don't know, projects or time in a lab being useful for the future, but they don't actually know what that means. So if you want to do something to gain points for your applications in the future, I would first of all make sure that you research these applications as best as possible to know exactly what counts and what would give you the best sort of effort to points ratio. So an example I'll give with this is there were quite a few people in my years at med school who spent 3 months of their summer inside a lab just pipetting various solutions together. And and they were just hoping that perhaps they'll get their name on some publication, or at the very least they can say that they spent 3 months in a lab. So that's a huge amount of effort for something which may not give you anything out of it, actually, anything tangible out of it. Whereas there were other people who knew how the FPass point system worked and spent some time finding articles on PubMed that they were interested in and writing responses to that. And some of those responses got published, and that gives you some points. And that's a fairly low effort, high yield approach to it. So I'd strongly recommend, before you do any of this sort of research type thing, if you're purely doing it for like kudos or points, make sure you know exactly what it's worth before you actually go into it. As for personal interest, I can't really give very much advice about it, to be honest. You need to just explore whatever subject you're interested in as much depth and breadth as possible. You need to see the good and the bad. And essentially, that's something that most medical schools, they give you like a student selected component where you can explore it in some more detail. And then finally, with personal ventures, we've heard a lot of messages from various medical students wanting to develop educational resources and apps and all sorts. And it's inspiring to see how avidly they pursue these ventures and how inspired they are by their own idea, which is a nice feeling. When you have an idea which you think works, it's easy to get a little bit carried away with it. So like, I completely encourage all medical students to be as ambitious as possible and follow any ideas that you think have some sort of purpose. But it's very important to cast a critical eye over it as well, because personal ventures, out of all three of these things, are the ones which can end up sucking up most of your time. So you don't want to end up going through with your own personal project for months or years and dedicate loads of time to it, and perhaps at the expense of your normal education, your social life, if it's not actually going to come to something. So you do need to critically analyze, is it something that will benefit other people? Or is it something that'll potentially be just a waste of time and it's not actually necessary for anyone, really? And last thing we wanted to say was just a nice quote that I found a while back. It says, "Set your goals in concrete, but your plans in sand." And I think that encapsulates a good sort of way of going about medical school and I suppose life to some extent. So at the start of medical school, you have your goals. You want to pass medical school, become a good doctor. And that's not really something that's going to change. But the way you go about it should always be subject to regular reevaluation, basically. So if we focus on study skills and revision, which has been the main sort of crux of this talk, when I started med school, as the same as most people starting med school, I had absolutely no idea what I was doing. I had no idea how I should be learning. And I went through loads and loads of different methods of studying, or like essentially gaining from lectures. So at one point I was just making notes in a notepad. At other times I was printing slides and annotating around it. And essentially I kept on just thinking, well, is this actually working for me? Probably not. Let me try something new. And I think that's a good approach to take. So you want to make sure you always essentially evaluate whether whatever plans you made or whatever methods you're employing to achieve your goals are the best possible option at the time. And if it's not, you should just try something different and just keep going until you find something that really does work. So that's everything from us. I think Andrea is going to come back to lead the Q&A session.
Right. Thank you both. Now moving to our Q&A session. We already have some questions, but feel free to leave yours in the chat box. So the first one is it worth doing questions before you feel like you know enough?
Ollie, do you want to take on?
Yeah, so I'd say yes, it is, because you can actually learn. You actually learn whilst doing SBAs. So when Laz showed the SBA on ectopic pregnancy, so within the clinical, within the vignette, you could actually see how ectopic pregnancies present and also how they're investigated. And with the explanation as well on management, that's basically everything you need to know for an ectopic pregnancy. So one of our takeaway messages is that it's, don't leave SBAs to the last minute, like a lot of people do. They tend to leave them in the weeks leading up to the exams and basically just run out of time. You want to do as many as possible from loads of different resources. And I was just using SBAs alongside my notes that I'd already written. And I was using the explanations and the SBAs just to update my notes. And by the time exams actually come around for 5th and final year, I was just so much more comfortable approaching these questions than I was in 3rd year when I basically started doing SBAs way too late and spent too much time reading textbooks and going through notes. So yeah, so I think it is worth doing SBAs early on because you can use them to learn from, basically, and you can use an SBA book like you would a textbook. So yeah.
Yeah. So just to quickly add to that point, I'd also like to stress the point that medicine is kind of finite. There's only so much you need to learn, as hard as it can be to actually define what you need to learn. But in terms of medical school exams, especially SBA exams, there's only a certain number of ways in which you can actually describe a certain condition. There's only a certain number of ways or phrases you can use to describe appendicitis or gallstones or anything like that. So essentially, the more SBAs you expose yourself to, the more you're essentially trained to identify those patterns. So I did loads and loads and loads of SBAs before my 3rd year exam. And essentially what I found was when I went to my actual 3rd year written exam at Imperial, I felt like I'd almost seen all of these questions before, because there is only a finite number of questions that can ever be written in medicine. And I felt like I'd exhausted all the resources that were available. And so when the exam came around, I genuinely felt like I was doing a past paper that I'd done before.
Okay. The next one, what would be your one main tip for doing well in medical school exams?
Ollie, do you want
to? One main tip. So SBAs aside, I'd probably say I used to be very rigid when I'd revise. So as Laz has kind of already been through, I used to kind of do hematology one day, cardiology the next day, neurology the next day, respiratory the next day, and so on. And I know Laz already kind of said this, but by the time you get to day 10, you've forgotten all the cardiology that you did 10 days ago. And I only really appreciated this in my final year. So when I started to mix things up, when I was doing 3 or 4, 5 specialties a day, I just found everything came together so much better. Doing one thing every day and being rigid like that isn't reflective of your exams, and it's definitely not reflective of real life in medicine. Yeah, so when I did vary things up, it just meant there weren't these long gaps between certain specialties. And yeah, that would be one of my takeaway messages. Try not to be too kind of set in stone how you revise. Be willing to mix things up and just use variation to kind of reinforce your learning. Is there anything you want to add, Laz?
No, basically the same thing, to be honest. There's a few questions I've built up on the chat as well.
Okay, thank you. Is there anything that you would do differently if you were to start med school again?
I suppose for me, this is kind of different from SBOs, but I didn't really become fully comfortable with talking to and examining patients till fairly late on in medical school, and that's probably because I maybe didn't throw myself into firms in the early years, and I think a lot of people have this tendency to waste time in firms and they just aren't productive. And at the other end of the spectrum, there's people who spend maybe hours and hours in firms, and that's brilliant if you're actually learning, but it may be at the expense of like library work and studying for your exams. So I think if I could do anything differently, I think just having a bit more of a balance between being productive firms and studying. And there's no real point in like hanging around in firms if you're not really learning anything, and that becomes more important as you kind of approach your exams. Anything you want to add, Laz?
I'd probably add. I think it's also one thing. This is quite specific, and I think it probably applies to Imperial quite strongly as well. There's a tendency for older med students to pass on guidance and like information, basically like we're doing right now. And that's very useful. Like I find that very useful for being able to prepare my revision and knowing what to do and what not to do. But one issue with that whole concept is that you also get scaremongering happening. So using Imperial as an example, and I know quite a lot of people on the chat are from Imperial, there's a lot of negative rhetoric about fifth year being terrible, about how everyone's likely to go through some sort of meltdown in fifth year. And I just find that so damaging, because before someone has even started fifth year, they're already expecting to somehow have a breakdown. And one thing I'd say is take all this advice on board, but especially if there's something negative, anything in any way discouraging, I just essentially just cast that aside. Like, that's essentially saying, fine, the year is tough, but don't assume that things are going to be unbearable before it even starts. You've got to give it a chance, and you've got to approach things with the right mentality.
Thank you. What tips do you have for third years? This is coming from someone at Imperial.
So with third year, I suppose is similar in most med schools, and it's all about sort of developing your clinical skills and also being able to develop your clinical reasoning as well, and be able to answer the exam questions. So to be honest, with third year, like Ollie's already mentioned quite a bit about firms and making sure you get the most out of it. But in terms of written exams, we've already kind of said all this before, to be honest. It is useful to know which conditions you're expected to learn, but it's also very, very useful just to do loads and loads of SBAs. So I'm sort of semi-answering something that someone else has asked a bit later about how I went about making notes. So in third year at Imperial, we have something called Sophia, which essentially lists all the conditions that we need to know. It's a pretty long list, and it has these very discrete learning objectives underneath it. And some people like it because it's kind of reassuring. It's nice to have this place where we know all the knowledge is outlined. But the problem is, if we think back to the whole discrete versus pattern recognition concept, all of that is preparing you for discrete questions, which is not what happens in the exam. It's not what happens in real life. So essentially, I made notes on all of the topics on Sophia, which I didn't find amazingly helpful. It would have been a useful thing, like the notes, if I had that right at the start, it would have been useful to refer to, but I didn't think the act of actually making all of those notes was that beneficial. And in fact, after I'd made those notes, I rarely actually went back to them. I basically just did every single SBA book and every single SBA website I could find online or on Amazon. And that's what I felt prepared me really well for third year.
I think I'll just say as well, this sounds really obvious, but I didn't really start doing it till fifth year. So I'd say when you're on your firms, this is specific for firms, but when you're actually on the clinical attachment, study for the specialty that you're actually on. So if you're on a obstetrics firm, study obstetrics at home and do obstetrics SBAs, because when you're studying and looking at SBAs on ectopic pregnancy and other things, shoulder dystocia, it's really reinforced when you actually see these things happen in real life and see them be diagnosed and managed. And when you have teaching sessions, it actually makes them a lot more useful, and it will actually make ward rounds and clinics a lot less embarrassing if a horrible consultant is grilling you about something. And I didn't really start doing it until fifth year, and I wish I would have done it in third year, even though it sounds quite obvious.
Okay, thank you. Do you recommend using notes from older years, or did you benefit from making your own? For clinical years, do you suggest notes or SBAs?
I'd say that's very much a personal thing. So some people really like making their own notes. I'm actually one of those people. But then others are quite happy to use older years notes, especially if the older years notes are laid out in a way that is compatible with your brain. So essentially, that's a difficult question to answer. And again, like Ollie mentioned earlier, I don't think you should view these different resources as being independent of each other, because you can use notes and complement that with some SBAs on the side, and that's exactly what we're encouraging. We're encouraging people to start SBAs earlier, not necessarily do SBAs instead of anything else, because the way that you revise and the way that knowledge actually gets into your brain differs from person to person. Some people might have like physical flashcards, others might have online notes or handwritten notes. That's completely down to individual preference. But yeah, so we can't really give a straight answer to that question.
Okay, thank you. How many SBAs do you guys generally recommend per day, and how early should we start in final year, for example?
Ollie, do you have an answer to that? Is he frozen? Oh, I think he's just gone off. Okay, so I can answer that. So, sorry, so was it specifically asking about final year, was it?
Yes.
Okay, I suppose it's kind of applicable to any clinical year. But again, it sort of depends on your phase of revision. So for example, in 5th year, when I was on my obs and gynae placement, I would probably do maybe about, it wasn't daily, but if I did sit down and do some SBAs, I'd do perhaps about 20 to 30 SBAs and just learn whatever I can from them. And also there's this concept of almost running out of SBAs or using them up. But one thing I'd make fairly clear is that there's literally so many SBAs out there that first of all, it's unlikely that you're going to complete them. And even if you somehow do, when you go back to the first set of SBAs that you started, you're not going to remember any of it. So you can actually do it more than once. And I've done that with all the resources I've used before, where I've used them several times.
Okay, thank you. How do you structure your notes? Did you make them on each condition covering all the key points, or are there other ways?
So because I'm at Imperial, I essentially use the Sophia framework. And so just to quickly describe that to you, it'll say some condition, like, I don't know, cholecystitis, and then it'll say a few specific bits of knowledge you should know about cholecystitis. So it'll be like outline the epidemiology, what are the signs, what are the symptoms, what are the investigations, what's the management. So that gave somewhat of a framework to my notes. So that's essentially how I structured the notes in the clinical years. In 1st and 2nd years, so the preclinical years, I'd mainly just do it based on the lectures, to be honest. So I was talking earlier about how I went through a few different methods of trying to gain from lectures before actually finding something that worked. And the thing that worked for me anyway was just sitting at the lecture with my laptop in front of me and having the lecturer's slides up as well. And luckily for me, I can type pretty fast, roughly at like a conversational pace. So I didn't really engage much in terms of my brain actually paying attention to the lecture, but I just hear what the lecturer was saying and just type down what they were saying at the bottom of the slides. And that would then be converted into notes. So for preclinical years, it was essentially the same structure or format as a lecture, whereas for clinical years, it was usually following some sort of basic template like Sophia.
Okay, there's quite a few people asking who these books are for, if they're for 1st year, 2nd years, final year students.
Okay, so these are all clinical year books. So for the classic 1st and 2nd years, which at Imperial is fully preclinical, these wouldn't be worthwhile right now. The blue book is on medicine and surgery, which for most medical schools, that'll be years 3 and 5, or at Imperial it's 3 and 6. So it does vary a little bit, but so, like, generally speaking, most medical schools will have 3 clinical years. 2 of them will cover medicine and surgery. The other one will cover the clinical specialties, which are obs and gynae, peds, and psych. So the blue one would be applicable to those 2 medicine and surgery years. So at Imperial, that would be 3rd and final year, because we found that final year wasn't actually much of an extension of 3rd year. It's essentially the same stuff. You might learn a few things which are perhaps in a bit more detail than you covered in 3rd year, but there wasn't actually that much difference. Whereas the clinical specialties tend to be packaged into a separate year at most medical schools.
Okay, thank you. I think we still have time for around 2 questions. So next one is, do you guys have any advice for balancing SJT prep, PSA, OSCEs, writtens, AFP preparation, etc. during final year?
Okay, so just to break that down, first of all, the SJT, to those of you who aren't so aware of it, it's sort of like a judgment test that you do around December or January of your final year, and that sort of dictates where you end up for your first job. SJT prep, to be honest, I'm one of those people who doesn't think SJT prep is really that possible. I only spent a couple of days preparing for it by doing the official online past papers. It's useful to familiarize yourself with the format, but there isn't really that much more you can do about it. As for the rest of it, to be honest, I tend to leave OSCEs closer to exam time, just because things like going through the examinations and making it slick, that's something that can be done fairly quickly by just practicing with your friends. So I didn't really see that much benefit in doing OSCE practice very early. As for writtens and PSA, writtens I sort of just did SBAs throughout the entirety of final year. And AFP preparation, again, that's fairly specific, but that's something that tends to be finished by around November, December time anyway. So I wouldn't say it really affects all the other things that you're mentioning.
Okay. How did you balance revision with doing audits and research projects?
So to be honest, I've always just compartmentalized things as, so when I say compartmentalize, I mean things which are like revision, extracurricular projects. I'd always just keep them separate, because I think there's a tendency for people when they're juggling lots of different things to essentially be worried about all their other commitments whilst they're working on one of them. So for example, you might be revising, but then you're just thinking, oh my gosh, I've got this audit research deadline in a week's time. And that means that the efficiency of you doing either isn't particularly high. So it is sort of a mentality thing. You need to be able to think, okay, this evening I'm going to dedicate just to audit, or just to my research project, or just to revision. So that is somewhat of a mindset thing that you will need to develop. But I think having a good way of organizing your to-dos is very useful. And I use like to-do apps and things like that as well, just to make sure I have it clear in my head what my commitments are and which things are more pressing and which things aren't.
Yeah, I'd agree. I'd also just say you have quite a long summer break and quite a long Christmas break. We did it in Imperial anyway, so you could focus some of that time on doing the extracurricular audits and things like that, and just save term time for doing your clinical work.
Yeah.
Okay, thank you. To avoid doing one specialty rigidly a day, would you recommend doing 1-2 topics from each specialty per day?
Yeah, that's exactly what I did, really. So if we take the 5th year sort of specialties as an example, I'd probably do, let's say, like I mentioned earlier, peds gastro and peds rasp. Then I'll take a break from peds and do a bit of psych, and yeah, I'll do a couple of topics of each. Yeah.
Yeah, I'd completely agree. Yeah, like I was saying earlier, I was very rigid in my early years, and I found it was actually much more practical and much more useful just to vary things up and maybe do 2 or 3 specialties a day rather than just sticking to one.
Okay, and last question, what advice would you give to medical students who want to work on a big project like writing a book?
So I sort of touched upon this earlier. It's great to be ambitious, and I do definitely recommend that to people. And like I find it like, I don't think anyone should ever think that you're like unable to do something. So having ambitious projects is a great thing, and I really like that, especially in young people. You're full of sort of motivation and drive to do these kinds of things, and all of you are at university where you have like-minded people to bounce your ideas off. But I would say it is important to just be very, very pragmatic about it as well. Just think of how motivated are you to do this? What are your other commitments? And also, what is this idea? Is this idea going to go far? Is it something that people will want to read or want to use? You've got to try and detach yourself from the idea as much as possible and ask for the opinions of other people, not necessarily friends and family, because I imagine they'll just echo what you think. But essentially, you do want to make sure you have a clear plan for whatever extracurriculars you're planning on doing before actually embarking upon them.
Okay. I think we got all the questions. So just to sum all of this up, we have a special promotion for both these titles. You can get them at 30% off the listing price until the 23rd of September on our website. The discount code, you can see it on the screen, is WSRevMED30. So you can buy both of these books, all formats, until the 23rd of September at 30% off. I would like to thank both Lasith and Oliver for joining us today, and thank you all for accepting our invitation.
Thank you, everyone.
Thank you.
Thank you.
Thank
Thank you.
Thank you.
Thank you very much.